In this video, we're going to discuss the health belief model. But first, let's start with a hypothetical question. Let's say everyone's favorite Sesame Street monster, Cookie Monster, is going to the doctor for his annual checkup. After hearing about his diet and taking some physiological measurements, the doctor is put in the awkward position of telling Cookie Monster he needs to change his ways or prepare for some serious health issues, such as, well, diabetes. Alarmed, Cookie Monster has to decide his beliefs about the behavior and the outcome. For instance, Cookie Monster might wonder whether diabetes is a foregone conclusion at this point. Or he may wonder whether it is the cookie eating that is the real problem. Maybe we could just get by with cookies, but exercise more or take supplements. And very importantly, does Cookie Monster have the tenacity to turn tail on his titular treat? Depending on Cookie Monster's perceived answers to these questions, he may or may not follow doctor's orders. The health belief model parses apart 6 core beliefs that contribute to our likelihood of engaging in a health behavior. First, we have a mental representation about the health outcome we are trying to avoid or promote. For this, we take into account the perceived susceptibility, that is, belief about our general risk, as well as the perceived severity, that is, what might happen to us if we in fact do get sick. If we think our likelihood of getting an illness is low, then we are less likely to care about engaging in a preventive behavior. Similarly, if we think that coming down with an illness is no biggie, we similarly won't put the preventive behavior high on our list of priorities. These perceptions are independent, of course, and it is possible someone feels highly at risk, but that it won't be a big deal, or that the severity is high, but we aren't likely to get sick. This is a major issue during the COVID pandemic, where many people believe their risk is extremely low or believe that coronavirus is less serious than it is portrayed in media. Thus, they refuse to engage in preventive behaviors such as mask wearing or social distancing. This is why the downplaying of the severity of COVID by the federal administration was so detrimental to public health efforts. It convinced a large portion of the nation that the health behavior was unnecessary. Perceptions of susceptibility and severity are dynamic, however, so messages targeted at increasing either can potentially make people more likely to believe that they should begin engaging in the specific health behavior. In fact, this is exactly what public health officials are attempting to do. Public health officials have been attempting to highlight not just mortality rates, but also long-term detrimental effects of COVID exposure even in healthy adults, as well as break the perception that COVID only affects elderly. Next up in the health belief model, we need to feel that the benefits outweigh the barriers. Perceived benefits refers to the belief that engaging in the behavior will help contribute to desirable outcomes or avoid the undesirable outcomes. For instance, Cookie Monster needs to be convinced that curtailing confectionery consumption contributes to a comeback in constitution. The barriers, on the other hand, are any perceived issues that prevent or add greater difficulty to engaging in the behavior. For instance, Cookie Monster may find that failing to feed on feasts of his favored food will fatigue his figure, frame, and physique. The health belief model argues that people only engage in a behavior if the perceived benefits outweigh the perceived barriers. For the COVID example, people's beliefs regarding the ability for masks and social distancing to prevent spreading the virus need to outweigh their focus on the physical discomfort of wearing masks and the social discomfort of maintaining distance. If the balance between barriers and benefits is skewed towards barriers, then there are 2 options. First, interventions can attempt to increase perceived benefits. For instance, public health announcements can show data regarding reduced output and intake of salivary molecules when wearing masks. However, at some point there is a ceiling to the amount of benefit one can get out of a behavior. Therefore, a more effective option is to reduce the perception of barriers. For instance, entrepreneurs are developing more comfortable masks, and many businesses are attempting to make social distancing easier to follow and feel less awkward. In fact, you may have noticed CDC guidelines getting more relaxed as time goes on. This is primarily due to changes in our understanding of COVID, but also an attempt to find the sweet spot between effective prevention behavior without the barriers being so high that people simply refuse to engage in the behavior at all. Public health officials are faced with this challenge regularly and have to find the right balance or their PSAs will go ignored. The health belief model also recognizes that even with strong beliefs that the behavior is important and beneficial, we may not engage in the behavior. They attribute this to 2 factors. First, humans are just generally distracted by other things. Thus, we need cues and reminders to engage in a behavior. This is why many states require businesses to have wear a mask signs, aisle direction markers, and checkout line spacers. These remind us that things aren't normal and we have to be careful in our behavior. We also need to feel that we have the capacity and efficacy to follow through on a behavior. That is, do we have the power to do what is necessary? Back to the Cookie Monster example, Cookie Monster might maintain that the mastication of marvelous munchies is just too mighty. Although there is little self-efficacy necessary for putting on a mask, initially people struggled to purchase masks and many people still feel confused about whether the mask they are wearing is actually CDC approved. For instance, research suggests that the felt gator masks actually increase the number of salivary particles that people spread. People may also feel that they don't have the willpower to keep distance and may give up on the effort entirely. Thus, efforts to increase health behaviors should focus on increasing people's sense of competence and ability to engage in the health behavior. By examining each of these 6 core beliefs simultaneously, we can have a comprehensive understanding of why people do or do not begin a health behavior. As the semester continues, we will return to this model, particularly focusing on specific barriers to health behaviors. For instance, many groups have poor access to health care, or the costs of medical treatment are prohibitive. However, before we get to that, we will cover one last model useful for understanding not only how we begin a behavior, but also how interventions can help maintain those health habits.